Welcome to the short abstract presentation on our recent manuscript presenting allergic disease trajectories up to adolescence and their characteristics, early life, and genetic determinants. For this study, we used data from the German GINIplus and LISA birth cohorts, where we had yearly information on doctor diagnosis of asthma, atopic dermatitis, and allergic rhinitis available from birth to 15 years of age. These were aggregated at several time points, and further clinical variables were measured. Results from this study were replicated in the independent Swedish BAMSE cohort. We identified 7 allergic disease clusters using a longitudinal clustering approach. While the second to fourth cluster shows single disease trajectories with different disease courses and age of onset, the fifth multimorbid cluster includes all 3 allergic diseases. All 7 clusters were robustly replicated in BAMSE and validated using further sensitivity analyses. Associations with early life determinants and clinical characteristics such as lung function measurements and allergic sensitization were investigated using multinomial regression models. For example, older siblings and pet ownership serve as protective factors for the rhinitis cluster. In addition, clusters including relevant portions of asthma patients show significantly reduced lung function values. Furthermore, we calculated 4 different polygenic risk scores for any allergic disease, asthma, dermatitis, and rhinitis, based on published GWAS results to assess the genetic predisposition for cluster allocation. For example, the multimorbid cluster is significantly associated with a polygenic risk score for asthma, while the pure rhinitis cluster is not. Concluding, we identified 7 distinct trajectories describing common allergic disease courses and characterized these regarding the genetic, early life, and clinical features. This more detailed classification might help to facilitate prevention strategies of allergic progression in the future. If you're interested in further findings, please have a look at our paper openly available at Allergy. Thank you very much for your interest, and our further expressed gratitude to our study participants, hosting institutions, and funding bodies.